Hi friends, this is Sajina. Today we can see synthetic antifungals. That is the second type of antifungals. These are chemically synthesized for the treatment of fungal infections. And they are broadly described in the following categories. They are thiocarbamates, allylamines and benzylamines, and azoles. First we can see thiocarbamates. These are mainly a group of pesticides with a wide range of uses. Some are acting as fungicides, some are having herbicidal activity. One of the most commonly used one for fungal therapy is tolnaftate. Tolnaftate, it is mainly available as a topical drug used extensively for the treatment of dermatophytosis. It is available as a 1% antifungal cream or lotion, and it is less effective in Tinea pedis because of poor penetration. Tinea pedis, it's a type of dermatophytosis. Second one is allylamines and benzylamines. They are having a wide spectrum activity. It is mainly inhibiting an enzyme involved in ergosterol synthesis, that is the enzyme Squalene epoxidase is inhibited. This results in the accumulation of squalene, and weakening of the fungal cell membrane is the result, and the fungal cell death is the final result. Potential fungicidal activity can be seen and is having a broad spectrum activity against dermatophytes, dimorphic fungi, Aspergillus Candida, etc. The following are the clinically important and frequently used therapeutic agents, that is Naftifine, Terbinafine and Butenafine. First one is Naftifine. It is also known as Exoderil. It's a topically active drug. Naftifine hydrochloride is available as 1% cream and is used for the topical application of various tinea infections or ringworms. Terbinafine, here it is acting as an oral and topical agent. Then it is having a high clinical efficacy against fungal infections of skin, nail, hair, and also some systemic infections. It is also inhibiting the fungal ergosterol synthesis by inhibiting the enzyme Squalene epoxidase. It is effective even at very low concentrations. High potency can be seen against dermatophytosis, rapid penetration, broad spectrum activity. Then terbinafine oral granules are given for tinea capitis in children. It is also another type of dermatophytosis. Next one is butenafine. It is a benzylamine derivative. The chemical structure and mode of action is similar to allylamines, and it is particularly active against dermatophytes, Aspergillus species and dimorphic fungus. It is also available as butenafine hydrochloride cream 1%. It is having fungicidal activity. It inhibits the enzyme Squalene epoxidase, thereby inhibiting the ergosterol biosynthesis. It is having a broad spectrum activity. Recovery rate is very high. Drug remains effective for several weeks even after the treatment is completed. So the relapse rate is very low. Third one is azoles, most frequently used, and we can see a 5-member azole ring attached by carbon-nitrogen bonds to the other aromatic ring. Depending upon the presence of 2 or 3 nitrogen in azole ring, azoles are classified into imidazoles and triazoles. That is, we can see 2 types of azoles, imidazoles and triazoles. Mode of action, they are mainly fungistatic. Inhibits sterol 14-alpha demethylase enzyme. This enzyme is also involved in biosynthesis of ergosterol. All azoles interact with Cytochrome P450 enzyme system in fungal cells, resulting in impaired ergosterol synthesis, resulting in fungal cell death. Imidazoles. Imidazoles, we can see 2 nitrogen molecules in azole ring. Commonly used imidazoles are listed below. Miconazole, clotrimazole, ketoconazole, iconazole, bifonazole, thioconazole, and oxyconazole. First we can see miconazole. It's an imidazole derivative, broad spectrum activity, available as topical and oral agent. Topical preparation mainly available as 1% cream for treatment of dermatophytosis, candidiasis, pityriasis versicolor, etc. And the daily dosage is about 600 to 3600 mg in 3 doses. Second one is clotrimazole, again a topical agent, effective in dermatophytosis and candidiasis, available as 1% cream or lotion. It is the first oral azole to be used for fungal infection, most often used in vaginal candidiasis. Ketoconazole, it's a choice or drug of choice for chronic mucocutaneous candidiasis, blastomycosis, ringworms, etc. Some side effects can be seen, that is anorexia, nausea, constipation, headache, hepatitis, pruritus, etc. Then the liver function test should be regularly monitored during the therapy. Available as 200 mg tablets. Also we can see ketoconazole shampoos for the treatment of dandruff. Then iconazole, similar in activity to miconazole. Side effects are irritation, burning sensation, itching, etc. Iconazole nitrate cream 1% is available for topical application in the case of some dermatophytosis. Bifenazole, it's a broad spectrum activity introduced for the therapy of candida infections. It is mainly effective or found effective in vulvovaginal candidiasis. Bifenazole shampoo 1% is also available in treatment of dermatophytosis and pityriasis versicolor. Next is triconazole. Fungistat is a topical antifungal agent. It is available as 6.5% cream. Oxyconazole nitrate 1% cream or lotion and is also known as Oxystat is available, highly effective and well tolerated in a wide variety of Tinea pedis infections. Next is triazoles, antifungal agents with 3 nitrogen in the azole ring. They are triazoles. We can see different types of triazoles. Some of them are listed below. Fluconazole, itraconazole, voriconazole, posaconazole, isavuconazole. First we can see fluconazole. It is mainly effective in yeast-like fungus infections, mainly for vaginal, esophageal, systemic candidiasis. Side effects are nausea, vomiting, abdominal pain, headache, skin rash, etc. A single dose is 400 mg and it is effective in pityriasis versicolor also. Itraconazoles, superior to other azoles, it is having a good absorption if it is taken after meals. Extensive distribution in tissues, less adverse effects, longer expanded half-life, broad spectrum activity. Effective in both superficial and systemic mycosis. Also be given to immunocompromised patients. No serious toxicity. Side effects are nausea, headache, raised liver enzymes. It is mainly available as 100 mg capsules. Next is voriconazole. It's a potent broad spectrum activity antifungal agent, more effective in blocking candidial sterol biosynthesis. Strong activity against Aspergillus and Cryptococcus also. Broad spectrum activity against Candida species, low toxicity, good bioavailability and has both fungistatic and fungicidal activity. Posaconazole, it is having a broad spectrum activity and is a potent antifungal agent. It is active against opportunistic, endemic and dermatophytic infections, available as oral suspension, given as 800 mg per day. Used in bone marrow transplant recipients also. Fifth one is isavuconazole. It's a new azole antifungal drug and is having a broad spectrum activity, effective against yeast, molds and dimorphic fungus. Oral and intravenous formulations are available. That's all about synthetic antifungals. Hope you understand the session. Thank you.